Thank you. Thank you for the board for giving me this opportunity. Looks like a lot of enthusiasm is there in the crowd, and you all, citizens of San Leandro, want to see your hospital open. Could I have the light on for 1 minute, please? Before I go on with the presentation, I would like to make the gist of the proposal of Prime Healthcare Services to you first, and then I will go with the presentation. Our proposal, Prime Healthcare Services proposal, first proposal, keeps San Leandro Hospital as an acute care hospital with pretty much all the services it has in the present time kept intact, and may add more services. That's proposal one. Proposal number two, we keep the emergency room operate more efficiently. With all respect to Dr. Snooey, our hospitals, all 13 hospitals, we operate our emergency room without going on diversion or a closure. For example, Cedar Valley Medical Center, which I purchased 2.5 years ago, has not gone on saturation yet. Because of our policy of giving emphasis on the gateway, the emergency room being the gateway, we try to accomplish 15 minutes of wall time. In other words, the paramedics could come and sign out, guaranteed. It's not just expected, a guaranteed wall time. That means paramedics hands over the patient to the emergency room and gets back into the community where he belongs to serve other deserving citizens that are in emergency. And our average length of stay in the emergency room for a patient, average length of stay in the entire emergency room is less than 2 hours. We guarantee the waiting time of 20 minutes average. There are certain times it will be a little bit higher, but these are published data, and if possible, Dr. Snooey could get it and we will supply them through our spot data. Some of them are not published, but majority of them are published. Because of this policy of keeping the emergency room open all the time to serve the communities that we represent, we end up seeing more number of uninsured patients than any other hospital. It's simple, because when you keep the emergency room open all the time and you run that more efficiently, like we're mentioning, you naturally would service more uninsured patients. Therefore, primary healthcare hospitals, per bed capacity, based on the capacity, offer more charity care than any other for-profit or not-for-profit hospital in the state of California. It's a challenge. Okay, what's the other promise? Promise number 3, our third proposal of primary healthcare services. We will keep the existing union contract in place. And most important promise number 4, we will employ or keep the present employees, all of them or substantially all of them. Proposal number 5, we will infuse capital like we did in every other hospital we did. We promised to infuse $20 million in the first year as we proposed to the board in the detailed proposition. $20 million in the first year in San Leandro Hospital. Sixth, we're planning to have this hospital through a not-for-profit structure, which I will right now explain a little bit. But even then, we would continue to pay lease payments to the healthcare district. Okay. Therefore, either we pay taxes or taxes plus lease payments or lease payments. Both would benefit the community. The last, I heard a lot of talk about acute rehabilitation. By the way, one of our hospitals runs the second largest rehabilitation center at San Diego, created 9 consecutive years by CARF. CARF means Certification of Acute Rehabilitation Facilities, I think. Is that correct? Okay, all right. 9th time. I'm graded as the most accredited, prestigious organization. Why didn't we talk about, there is a 4th floor that is empty. Maybe there is a possibility. If the county is so willing to serve the acute rehabilitation needs of its citizens, maybe they could partner with us or some other owner of this acute care hospital to accommodate acute rehabilitation. It is like replacing the acute care hospital entirely, the emergency room entirely, with an acute rehabilitation facility doesn't sound prudent to me. For example, from your own members, you have 27,000 acute care patients that are coming to this emergency room each year. And let us take the same example of 5%, 1,000 patients that are coming under sirens and court trees. And these people need immediate care, not urgent care, not so urgent care. How many of these speakers would like to send their family, their mother, their wife, their children to the urgent care center when they are really in need? There is no substitute, ladies and gentlemen, for replacing a community health care resource safety net, the emergency department. No substitute. Having made the 7 salient propositions that Prem Healthcare Services is making here today to the board and to the citizens and to San Leandro Hospital, let me just quickly go through this because I have to go through this formality, and I would spare as much, use very little time except at the end again to reiterate these points in a little more detail. Every management has these essential components. Next. Okay. We are experienced management team. Next. All the people and all of them. My name is Prem Reddy. I'm a board-certified cardiologist and internist. Have practiced for 30 years in a small town like San Leandro in what's called Victorville and Apple Valley. I lived there for 30 years. Thank you. You know me. I treated you. Thank you. I am the chief cook and the bottle washer of Prem Healthcare Services, and I take the responsibility for all the promises and proposals I make today, and I stand by them. Next. It's our mission. You can read it. Mostly offering comprehensive quality healthcare in a compassionate, convenient, and cost-effective method, which is becoming very important now with the rising costs of the healthcare. Next point, please. Next. Next. Every hospital, almost every hospital we acquired, which is now 13 hospitals, we acquired them either in bankruptcy, they were already in bankruptcy, and we went through the court and acquired them and then turned them around, or were about to go into bankruptcy. In other words, they were all in financial distress, except for our intervention. All these 13 hospitals would have been shut down or non-existent. That is our model, and that's our philosophy, and that's why we put our money in turning the failing community hospitals like San Leandro into successful community healthcare resource. Thank you.